Well, we're seeing a dramatic increase. In the last month, we've gone from about 300 people a day to probably today we're going to crest 1,000, probably about 1,200 people is the early guess, because we've had quite a bit of activity this morning. So that's what we're seeing here at the border in the Yuma sector. But really the end result is how much does Border Patrol have to release to the local NGOs, and can they handle that level? So that's the concern we have, and we're preparing by advocating. I guess earlier this week I was with the governor talking about resources that we could need, we might need, how that could play out. We've done the same thing with our federal partners, and then locally we've just been coordinating and looking at options, because frankly the size of this and the duration is unknown, and it's very difficult to plan anything with those kind of parameters. Well, I'm working hard to prevent people on the streets of Yuma. So in other words, that Border Patrol and the NGOs have the capacity to handle everything in a very organized manner. But everything has limits, and when Border Patrol gets overwhelmed, people might just start moving through the community without engaging, or if our NGOs get overwhelmed, then Border Patrol potentially could release to the streets. So we're trying to prepare, but really we're trying to prevent any of those situations from happening. We have really one major nonprofit that's engaged day to day, and that's the Regional Center for Border Health. They receive people directly from Border Patrol and then help them get on buses to go to their ultimate destinations or to airports in the region for those ultimate destinations. But I did just meet yesterday with our pastors in the area, talked about potential needs that we're going to have, and so they're seeing what they can provide. NGOs, the other NGOs in the area are constantly engaged in different levels, but as far as engaging directly, Regional Center is our primary NGO for that. Well, thankfully we have a strong hospital. They're able to weather that storm, but ultimately, like any business, they're going to pass that on into their overhead, so that ends up in our bills as we utilize the hospital. So that's why it's so important to get that paid back. It's just not that the hospital needs to have all their bills paid. It's just they get, in any business, they get impacting the bottom line. So it's really advocacy, working with our federal partners to try to find reimbursement avenues, but those are getting less and less at a time we need them more and more. Thank you.